I'm Susan Moffatt-Bruce. I'm a thoracic surgeon, and I'm also the president of the Lahey Clinic in Beth Israel Lahey Health System. I am the chair of the Council on Health Policy and Relationships, and I have been so for the last 6 months. The STS Advocacy Conference is very, very important to us. There are 3 major issues that we are going to address whilst we are here in Washington. Firstly is to stop the decrease in reimbursement for Medicare relative to the patients that we care for. Secondly is to really advocate for mobile lung cancer screening. And thirdly is really to advance the issues relative to reimbursement and to funding for cardiac surgery as well as thoracic surgery research. These 3 issues are key to the success not only of our profession, but more importantly for the patients that we serve. And so as the STS is the only society nationally and internationally that advocates for cardiothoracic surgeons and the patients that we serve, we have a great opportunity, and I would add a responsibility to truly be here in Washington at this point in time. Every cardiothoracic surgeon that is part of the STS can get involved in advocacy. Reach out to a colleague that's already a member of the STS or has a leadership role. We are always very, very happy to take interested colleagues, walk them through the process, and to include them in each and every opportunity and relationship that we are building.
I'm Elliot Servais. I'm a thoracic surgeon at the Lahey Clinic in Massachusetts, and I also chair the STS Task Force on Lung Cancer Screening. It's a privilege to be here at the STS Advocacy Conference this year, where I'm particularly interested in lung cancer screening and advocating for increased coverage, and in particular, the Mobile Cancer Screening Act. We know that since 2021, with the expanded criteria that made about 15 million people in the United States potentially eligible for lung cancer screening, only a small fraction of those patients are actually getting screened. In fact, less than 20% nationally. We know that we can do a lot better than that. And the Mobile Cancer Screening Act in particular will allow us to bring screening out to the people who are eligible and who otherwise might not be able to get this important study. Surgeons play an incredibly important role in this because we are foundational to the programmatic approach to lung cancer screening. To do lung cancer screening right and to make sure that we are accessing the right patients, to make sure that we are safely screening patients and then curing their cancers, thoracic surgeons are critical. So I'm here today to advocate not just for lung cancer screening and the Mobile Screening Act, but also to encourage my colleagues across the country and members of the STS to work on this and stand up and advocate for our patients. I think one thing that we're going to be sharing with the STS members is all the work that the STS and the Lung Cancer Screening Task Force have done to really provide a roadmap and details to starting a mobile screening program. Furthermore, we're going to try to educate people on what this Mobile Cancer Screening Act is, why it's important, and then we're going to try to actually go and talk to our representatives and talk to the people who can help get this funded. At the end of the day, we need to ensure that the legislation supports the work that we do. We also need to ensure that there is funding for the research that we need in this space. We're fortunate to live in a time where we're making incredible progress in lung cancer research, particularly as it relates to resectable lung cancer, and all of that depends on continued funding. So the work here that we're doing at the STS to advocate for this and to advocate for this kind of legislation is of the utmost importance, and I think it's an important aspect of the Society of Thoracic Surgeons.